What happens in women?
Women's, most of them who are in the reproductive age group, they get into the infertility groups where they get into the morbid obesity, blood pressure will be starting, polycystic ovary disease, and the infertility issues. And again, back to stress, blood pressure mounts, and it will be like a vicious cycle. They'll be into the vicious cycle. And at one point, it will lead to a end organ damage.
So explain to our audience what is end organ damage and why blood pressure is a problem on a long-term basis. People talk about diabetes as a bigger problem.
Exactly.
But blood pressure is a killer disease as well.
See, blood pressure is something which everybody is awake and it is required for every normal human being.
Correct.
See, every patient, what they'll say, I have a pressure. Pressure is normal. Pressure should not be treated.
Yes.
It is normal for you to be awake, for you to run, for you to work.
Talk.
Everything you need a pressure. You need the blood to be pumped to your organs. But what happens is like, once you are falling into a category where you have a sleep deprivation for a long time and you have not slept. What happens? The normal stress hormones, which has to be released only during stress, will be normal for you. And these stress hormones will be always high on your side. Without your realization, suddenly your blood pressure will be 140, 150, 160. Suddenly what will happen? Your company will have a project and you have a deadline that you need to complete this amount of time. And you never been checked your blood pressure thinking that you are being normal and you haven't checked your blood pressure for a long time. Suddenly what happens? This stress level mounts suddenly. And this blood pressure and your brain arteries are like 3 millimeter, 2 millimeters. Okay. What happens? Suddenly, when your blood pressure rises, there is a gush of blood going into these tiny arteries. What will happen? For a certain point, it will sustain it. And suddenly, when the blood pressure rises, these arteries cannot sustain it. They'll rupture.
When you say rupture, it'll burst open.
And the entire brain tissue, there will be a damage.
Which means blood.
So
the blood which is supposed to be inside the blood vessel will rupture and the blood will be in the brain surface.
So that is when this is called as, this is an end organ. So the blood supply is totally cut and it is totally damaged.
And what is the youngest age that you have seen?
As early as 24.
24?
24.
Are you serious?
Serious.
24-year-old.
24-year-old.
Wow. So I'm just asking, educate the audience.
Yeah.
If let's say a neighbor or a family member, how do we identify, if a patient is going through this? I know that there is a acronym called FAST.
FAST, yeah.
Can you educate us, please?
See, somebody is being, what I will tell my patients is, when you are known to somebody, you know how they are walking, talking, seeing, okay? When there is a disturbance in these activities, see, that's what we call it as a B.FAST, okay? Okay, B is like, see, normally you can stand with your eyes closed, okay? You can maintain your balance. Some people can balance in one leg also. So, and this balance will be totally disturbed, okay?
So B is balance.
Balance, okay. E is your eye. What happens to your vision is, either you can have a blurring of vision, okay, or you can have a double vision, or total loss of vision.
Double vision is you see
two things. Either it can be horizontal or a vertical on either sides. Okay,
so horizontal means on right and left, or up and down.
Okay, and you can have a total loss of vision.
You can see anything.
You can't see anything. Okay, so that is I. E. And FAST is
fast.
F is facial asymmetry. Okay, suddenly, normally when we laugh, your lips will be centralized. Symmetrical. It doesn't go on either side.
Correct.
So what happens when one side of the brain is affected, your face moves towards the opposite side.
Wow.
Okay, and that is F. Facial symmetry will be lost.
So that's why you said that right side controls the right brain controls the left side. So let's say that right brain has a stroke, then the left side will not work. So then the patient will deviate to the right side.
Correct. Okay.
Because this side doesn't work.
So the side which works pulls it.
So it'll be like this.
Yeah, exactly.
Face.
And A is your arms. So there will be a sudden drift, or you will not be able to move at all. Or there can be a simple change like a clumsiness, like whether you can lock or open a door. Only most often the stroke affects the distal part. Okay, so suddenly there will
teeny
be
fingers.
things they'll not be able to pick up a
Grasp
coffee,
it.
grasp it. They'll say, I was totally fine, but there is some kind of a clumsiness in my hand. I'm not able to pick it up fast. Okay, so that clumsiness itself is a sign of stroke. You don't need a major loss. Okay, that can be a TIA where they have that mild clumsiness. They may think it's normal. It's normal to have that clumsiness. Never. And yes is your speech. Speech. There can be
slurred speech.
There can be slurred speech.
Aphasia.
There can be a loss of speech, or I can tell this is a car.
Yeah.
Totally, you can
completely.
Your brain will not be able to pick the objects, and it will see is correct, but when it is coming as an output, it will be totally opposite.
So you look at the mic and you say it's a car.
Yeah.
But you understand.
You understand it's a mic, but when you are processing it out, it comes out as a car.
So expressive.
Aphasia. Then the last thing is a time. When you see all the symptoms, and make sure they go no first aid at all. Please don't do any first aid. That is a major thing.
I've seen people doing first aid.
Yeah. They still give keys in the hand.
When they have seizures, they give keys in the hand. That doesn't work.
That should not be done. It's not like it doesn't work. It should not be done.
So when a patient is seizing or having seizures, it's a common practice to give the keys.
That is in the 70s and 80s movie, which is loaded.
Why it shouldn't be done?
Because what happens is like, you do not have a control, your brain does not have a control over your body. What happens is like, so once you're given any keys or objects, you can self-harm yourself. Okay, you can hit, and the movement cannot be restricted. What happens is like, when you try to restrict the movements, there can be a tendon rupture, there can be a muscle damage. So you actually complicate more.
The only thing you should do is to keep the patient on the left hand side.
Pull to the one side of the body, so that they do not aspirate.
Yeah. They do not have the secretions back into the lungs.
Basically, yes.
Okay. So what is the time period that patient should get into the hospital?
Hospital as early as possible. It is not like, see, we have a window period of 24 hours now. Okay. You can save them from 24 hours. But for every minute, millions of neurons are dying.
Wow.
You cannot allow it, like, I have 24 hours time. Okay, let me not speak for some time.
Right.
So not like
earlier the better.
Earlier is the best.
So I'm summarizing. If somebody is seeing, let's say, a patient who has been working night shifts, stressful job, has hypertension for 5 years, and now having some facial asymmetry, not able to speak properly, and eye movement, he's seeing double vision, then we need to rush to the hospital right away.
Exactly.